Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside.
When a person is first diagnosed with cancer, the last thing on their mind is their future children and their fertility. I really encourage people that when they are diagnosed to explore options with your oncologist, as there will be life after treatment and you don't want to have any regrets after treatment when life is back to normal.
Infertility can be a temporary or permanent side effect of cancer, but there is good news to share about advances in fertility treatments for cancer survivors. Just ask Ashley Flynn, a cancer survivor who recently gave birth to her second son, Luke. And Ashley is with us today in our studio, along with her doctor, reproductive endocrinologist, and infertility specialist, Courtney Marsh. And I am Roy Jensen, director of the University of Kansas Cancer Center. Thank you for joining us on Bench to Bedside. And I'll start off with Dr. Marsh. Infertility can be obviously a huge side effect and a huge issue for patients with cancer, particularly with a number of our treatments. Why is it important for cancer patients to talk with their doctor about fertility preservation before treatment begins?
Well, I think something really important that has changed with cancer medicine is that people are living longer and surviving, and fertility is a concern. So where people might not have been living as long before, now they're able to have long life expectancy, and seeing us before the cancer treatment starts gives us a better chance of being able to provide the best options for fertility preservation.
So a cancer diagnosis obviously can be overwhelming and cause people to hesitate or postpone talking about fertility. Tell us about same day, next day consultations that you and your team can arrange before cancer treatment is begun.
Absolutely. We have built-in time slots to see patients the same day or the next day to talk about fertility preservation. We also do phone consults. We're very flexible in working with the team to make it happen.
Mm-hmm. So what are some of the advanced fertility options that you can make available to our patients, and obviously differentiate between men and women?
Yes. On the male side, freezing sperm is very effective. On the female side, there's been advances to help, especially for people who need immediate treatment. So we're one of the only centers in the region that can do ovarian tissue preservation, where we would take an ovary out so we could immediately freeze the tissue before they got started. Because normally it takes about 2 weeks to freeze eggs or make embryos.
Mm-hmm. So when you go to our Cancer Center website, you've talked about Ashley's case as being unique and special. What were some of the specific challenges that you faced in regards to making sure that her fertility was preserved?
One of the challenges we found, although they had tried to preserve fertility by elevating the ovaries out of the field of radiation, one of the ovaries had fallen into the field of radiation and was very difficult to retrieve eggs from. The other ovary was up by the kidneys and was very difficult to approach from our technique, which is a vaginal approach. So with the second attempt, we pulled in a specialized team of interventional radiologists to be able to get eggs from that ovary, and that really made the difference in this case.
Yeah. So Ashley, let's turn to your perspective now. Mm-hmm. Because you were diagnosed with colon cancer at such a young age, how did or when did the subject of fertility preservation come up, and sort of what were your thoughts about that?
So when I was diagnosed with rectal cancer at the age of 24. So the farthest thing from my mind at that time was starting a family. The biggest thing that I wanted to know when I was diagnosed was how to get the growing tumor out of my body so I could be cancer-free. Luckily, though, my medical and radiation oncologists were thinking about my future and within the first couple days of meeting them, they began to talk about my fertility and actually referred me to a KU reproductive endocrinologist to see what my options were. So today, I'm obviously so thankful that they were thinking about my future when I was not. I simply just wanted to know how I could become cancer-free, and they were thinking about my future family.
Mm-hmm. So you had to undergo in vitro fertilization. Could you tell us a little bit about your experience with IVF and that whole process?
Yeah, so the goal of IVF is to make a lot of eggs to begin with and then retrieve those eggs so that you have a large number of embryos to work with. Like Dr. Marsh said, though, one of my ovaries had fallen into the radiation field, and I was not able to retrieve a lot of eggs. So the main goal is to do one egg retrieval, get a lot of embryos so that you could then move on to the next step. I, however, had to do 2 egg retrievals just to get one genetically sound embryo, and that is my 2.5-year-old son, Sam. So my husband and I knew we wanted to have more than one child, so we actually ended up doing another egg retrieval, and we're blessed to get two embryos, one being Luke and one that is waiting for us to implant in the future.
Oh, wow.
So the process itself, though, I mean, it's truly an emotional roller coaster. I just remember telling myself, if I could just get, a certain number of eggs, then I would be fine. Or if I could just get one good embryo, then I would be fine. And it seemed like throughout the process, it was just another hurdle that you needed to jump over until you had that baby in your arms. And I always said I wouldn't be happy until I had a healthy baby in my arms, and now I'm lucky that I get 2.
Yeah.
Along with the emotions of IVF come a lot of physical pain. It has a lot of nightly injections that you have to do. You're taking a lot of other medications. You're undergoing a lot of different surgeries to retrieve the eggs and then also transfer the embryo. And then on top of that, it's also a pretty big financial burden. I mean, it costs thousands of dollars to undergo IVF. Luckily for cancer patients, there is help out there to help with payments for medications and then also for embryo storage and the other procedures.
So Dr. Marsh, you felt that Ashley's story was unique enough that it needed to be written up in the scientific literature. Could you tell us a little bit about that and sort of how the paper was received and what comments you've heard about it?
Yeah. So throughout my training, I had not heard of going for ovaries that were out of the vaginal field or in the pelvic area. We just kind of chalked that up to, well, we can't reach those vaginally and we just can't get those eggs. And we really weren't satisfied with that. So I talked to Dr. Zachary Collins, who's part of the interventional radiology team. And we just have a great group of doctors here at the University of Kansas Health System. And he jumped right in, read all the literature he could find, couldn't find any. But still, we went ahead and he thought he could do it, and we were able to do it. And then a interventional radiology fellow wrote up the case report, and it was published and presented at a radiology conference.
Oh, wow. So do you know if anyone else has been able to utilize the technique that you published to?
I know we're the only one in the region. I just did another case today for someone who'd had a renal transplant, and so her kidney was also elevated. So we work very closely now with interventional radiology, and have done about 5 cases so far since I've been here. But there's no one else in the region that can offer these services, and I would venture to say maybe people aren't doing this nationwide. So we really are on the cutting edge of technology here.
If you're just joining us, we're here with reproductive endocrinologist and infertility specialist, Dr. Courtney Marsh, and her patient, Ashley Flynn, a colorectal cancer survivor, to discuss advances in fertility treatments for cancer survivors. Remember to share this link with people you think might benefit from our discussion. Use the hashtag #BenchToBedside. Dr. Marsh, we have the largest reproductive medicine program in the Kansas City region, and how does our live birth rate compare to the national average?
Well, in Ashley's age group, we have actually the highest live birth rate. And that's actually true. We have a higher than average national. Ours is higher than the national average as well. So we have a very successful program, both in size and in success.
So Ashley, could you introduce our newest guest to the program here today?
Yes, this is Luke Flynn. He was born 2 weeks ago.
Wow.
Yes, so this is his big premiere.
Yes. So is Luke going to have his own Facebook page and Instagram and all that kind of stuff?
Hopefully not for a while.
Not for a while?
Yeah,
Okay.
I'm not making him one.
Well, I think he's already got a fan base out there, so that's cute.
Thanks.
All right. So, Dr. Marsh, what would you like our viewers to take away from this presentation today in terms of perhaps their own fertility issues around cancer?
Yeah, I think a few key points. One would be, don't be afraid to see a fertility doctor. We're not scary. Even if you don't want to do fertility preservation, we can do a fertility check and see how your fertility changes before and after treatment and advise you. Also, we have very advanced technology. That technology is advancing every day, and so even if you think you're not a candidate, you may be a candidate for fertility preservation. Another great thing about the University of Kansas Health System is we have a multidisciplinary team approach. So we work with the cancer doctors very closely. We work with interventional radiology. Honestly, we'll work with anyone within the health system to make an individualized plan to help women and men too to preserve their fertility. Mm-hmm. Another nice thing is that we do phone consults, or we'll see patients same day. So we really want to make it the best patient experience for the patients, because we know it can be very overwhelming. And we're accessible, and we allow time in our clinic every day for seeing patients. We do have IVF nurse navigators to help make it an easier situation, sort of similar to the cancer center. And we are here for you. So we want to make sure that if you have any interest in your fertility or questions, that don't hesitate to call us.
Yeah, well, that's great. So Ashley, as someone who's gone through IVF after surviving cancer, what are your key takeaways that you'd like our listeners to remember?
I would say, first off, for those who are dealing with cancer currently or have just been diagnosed, when you're first diagnosed, it's difficult to look towards your future. I think that it's important, though, to think about a life after cancer, because there will be one. So that's where you need to take the approach to talk to a reproductive endocrinologist to preserve your fertility, so that after you do beat your cancer, that you have the option to build your own family. And then as far as if you are going through fertility preservation currently, I would say just to keep your options open. I like to tell people that it only takes one embryo to make a baby. So I know a lot of people get discouraged if they don't get a lot of eggs or they don't have a lot of embryos, but it only takes just one.
So Ashley is a bit of a ringer on our show today, because you have been involved with the Cancer Center for a number of different efforts. You were kind of one of our poster, I wouldn't say child, because you're already 24 poster people, and for the Cancer Center, because you're even the story of your original diagnosis and treatment was something very much out of the ordinary, since it happened at age 24. And then you have been a really critical member of our Pivot group.
Yeah.
So maybe if you wanted to say just a little bit about Pivot and your involvement there.
Yeah, so Pivot is an organization within the KU Cancer Center where we actually take patients who have a cancer story, and even survivors or caregivers, and then try to match them up with researchers where they we're trying to make sure that the patient is involved in research, bringing research to the forefront of the patient experience, because research is what makes us more advanced and moves cancer care along.
Thanks. And then your background, your professional background, could you tell us a little bit about that?
Yeah, I am also a pediatric nurse practitioner at Children's Mercy in the oncology department. So, yeah, my life is full of lots of cancer and infertility and all of that. But I'm happy to use my experience with my cancer journey and infertility to help my patients at Children's Mercy.
Well, it's an amazing story, and we're so thankful that everything has worked out great. So that's awesome.
Thank you.
So thank you, Dr. Marsh and Ashley. That's it for today. To learn more, please visit kucancercenter.org/Ashley. Join us next time on Bench to Bedside. Thanks for watching.